XYZ ready, XYZ ready, XYZ ready.
Lecom, a 42-year-old man from Narok, comes to hospital with complaints of a neck swelling that has developed over the last 1.5 months. He also complains of difficulty swallowing food, mild difficulty in breathing, and that his voice has also become hoarse. List various causes of neck swelling. Categorize and give examples of various causes of dysphagia. Neck swelling. We have thyroid swelling, thyroglossal cyst, lymphadenopathy, bronchial cyst, lipomas, skin lesions, infections, e.g. Ludwig's angina, thymic swelling, and others. For dysphagia, we can classify it as oropharyngeal or esophageal. And as oropharyngeal, it can be motility related or structural. For motility related, we have neurological, such as stroke, Parkinson's, GBS, polio. Muscular, we have myasthenia gravis, CRIST syndrome, inflammatory myopathies. Structural causes, we have mucosal, such as infections, tonsillitis, epiglottitis. Aside infections, we have Zenker's diverticulum, oropharyngeal CA. Then it can also be classified as extramural. We have osteophytes, deep neck infections, cysts. Esophageal causes can be structural. So we can have extramural, mural, and intramural. Extramural, thyroid swelling or CA, mediastinal mass, hiatal hernia, lymphadenopathy, cardiac dysphagia. Mural causes, webs, rings, esophagitis, strictures, cancer, diverticular. Intraluminal, foreign objects, food impaction. Further history reveals that Lecom had Burkitt's lymphoma as a child, but was treated and fully recovered after radiation therapy. The rest of the history is non-contributory. On examination, the swelling is unilateral, solid, hard, and non-tender. You suspect that it's a thyroid nodule. How would you differentiate between a thyroid swelling and a thyroglossal cyst on examination? So for a thyroid swelling, it moves with swallowing. A thyroglossal cyst moves with sticking the tongue out. Lecom also has cervical lymphadenopathy. After presenting your history to a registrar, he asks you to write a radiology request form. Give 5 key details that should be in a radiology request form. What investigation is appropriate at this time? Radiology request form details. We have patient biodata, full name, sex, age, hospital number. 2. Type of investigation requested. History of allergy, last menstrual period if applicable. Brief clinical summary, which is mandatory. Investigation, neck ultrasound. You then ask to accompany the patient to the diagnostic imaging department. The radiologist reports a solid hypoechoic nodule with microcalcifications. He then tells you that he'd like to perform thyroid scintigraphy. He subsequently reports that the patient has a cold nodule and he performs an ultrasound-guided FNA-C for pathology. As an assignment, he asks you to read up on thyroid scintigraphy, cold versus hot nodules, and difference between FNA-C and core biopsy. So thyroid scintigraphy is a nuclear medicine test that assesses the uptake of radioactive substance and provides information about the structure and function of the thyroid. A hot nodule takes up radioiodine or functional, not usually cancerous. For cold nodules, they do not take up radioiodine, they're non-functional and 10% are cancerous. FNAC is a cytological sample, minimally invasive. A core biopsy is a histological sample, more invasive, more sensitive. The pathology report comes back after 2 days and it confirms that LECOM has a thyroid malignancy. The following microscopic observations were made: psammoma bodies, branching pattern of an nuclei, nuclear grooves, and pseudoinclusions. Bonus questions. Answer in the comments. What type of thyroid cancer does LECOM have? What surgical procedure will be indicated? What is the anatomical basis for LECOM's hoarseness of voice?
XYZ, 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 XYZ.